Good morning, everyone. Thank you for joining us here today for Opportunity Analysis, Job Quality Interventions in the NYC Home Care Sector. We're going to get started now or in a second. So I'm going to bring up Daniel Liss, Executive Director of the New York Alliance for Careers in Healthcare, to get us started.
Thank you, Faye, and good morning, everyone. It is a pleasure to be here with you today. As Faye said, my name is Daniel Liss. I'm the Executive Director of the New York Alliance for Careers in Healthcare, which is a public-private partnership with the New York City Mayor's Office for Talent and Workforce Development. We're focused on economic and workforce development, trying to nudge the sector and in a better direction and making things make more sense in a number of ways. So supporting the home care sector has really been a key focus of ours since NYACH's founding. And we know that the strain, lack of support, and frankly, lack of recognition over the past few years have only made things enormously harder, which is why we were so excited to have been working with the ICA group the past year or so on a project that looks to identify collaborative business solutions to support home care employers that are doing a great job for their workers and for their patients, and to advance job quality and real sustainability for our New York City's home care sector. Today's presentation will cover several leading and transformative initiatives aimed at improving job quality in home care, and I hope it illustrates for everyone why further investment and better infrastructure is really needed to support, reward, and incentivize really good practices and performance. So this morning and the sessions this morning will start and end in New York City and with home care, but we also have so much to learn from this morning's speakers from other areas of the country and our economy. And with that, I will hand it back to my colleagues at the ICA group to facilitate the rest of the meeting.
Thanks so much, Daniel. And thank you to you all for joining us here today. As we begin our program, I'm going to take a minute to go over the agenda for the rest of our time together this morning. First, I'll be doing a short presentation on the work that ICA has been doing in partnership with NYACH. Then we'll hear from a panel of New York City home care stakeholders, including Kim Allen of Cooperative Home Care Associates and 1199 SEIU, Andrea Thomas of Sunnyside Community Services, and Emily Dieppe of PHI. We'll turn next to a group of panelists who will share some of the innovative work they're doing outside of New York City, including California State Controller Betty Yee, Paul Spillman of Labor Exchange, and Liddy Romero of Work-Life Partnership. And to close, we'll bring the panelists back together for a moderated discussion. The ICA group, which I'm representing today, is a national nonprofit consultancy focused on building worker-centered workplaces, and we've had a key programmatic focus in the home care industry since the 1980s. Beginning in the summer of 2021, we've been working in partnership with NYACH to explore creative ways to support high-road home care employers, and this has involved a few different phases of work. First, we gathered data and did an in-depth analysis of the New York City licensed home care market, or the LICSA market. Then, in consultation with many in this room, including PHI on their 5 pillars of direct care job quality, we produced a preliminary criteria for high-road home care employment practices. And finally, we conducted an opportunity analysis to identify impactful ways to build on the sector's successes through additional coordinated support to high-road employers. And I'm going to give a snapshot of that opportunity analysis today. Before we talk about opportunities, we have to understand the market. And I'm going to go over this briefly, but we have a previous webinar that we can share. So what does the LICSA market look like? Pulling together a number of dispersed data sources, we found that the market has 528 LICSAs, those are the licensed agencies, a revenue of just under $6 billion, 274,000 direct care workers approximately working in LICSAs in New York City. And in the market, there's 86% for-profit agencies and 14% nonprofits. But what we were most excited to discover in working with this data is that the publicly available data actually includes information that reflects job quality and employment practices. This creates an immense opportunity to support existing efforts aimed at improving job quality and to build a knowledge base about what's actually happening on the ground. So when we talk about job quality data, this is what we're talking about. We were able to work with data on caregiver hours, caregiver turnover at the agency and industry level, and non-wage supports provided by agencies, such as health insurance, differential pay, or transportation support, among others. And while this data, including the hours and turnover data I showed before, may not be perfect and likely isn't, it shows us what could be possible and also definitely makes the case for continued investments in timely and consistent data collection. And when we look at this data, most importantly, we see that there's currently no market incentive to invest in caregivers. Using this imperfect data, we segmented the list of LICSAs into high road and non-high road agencies using that preliminary criteria. And when we did that, we saw that high road LICSAs have, on average, a lower net margin than other businesses. And while we all know that home care is a low margin business, period, this does show us that high road employers, those who are investing their limited resources in job quality improvements, are at a distinct disadvantage in the market. And if we want companies to be rewarded for high road practices, we really have to take a deeper look there. So this led us to a couple questions. First, how have employers been required, supported, encouraged, or even incentivized to invest in caregiver job quality beyond what's mandated? And second, what systems can support home care employers that are investing in caregivers? And these are the two main research questions underlying our opportunity analysis. We approached the opportunity analysis in 3 phases. First, to understand how home care employers have been supported in investing in job quality, we first needed to understand the core job quality needs. And so we reviewed research and consulted with partners to identify 4 main job quality challenges that I'll go over next in the next slide. Second, we cataloged all the great work, past and present, that's been done in the sector to impact job quality, much of which has been done by people in this room. We identified successes and also gaps and persistent challenges. And finally, we identified opportunities for collaboration among high road employers, perhaps through a network or other business formation, and how that could add value to this landscape. As I mentioned in the previous slide, we organized our opportunity analysis around 4 key areas of job quality needs for caregivers. And this list will be quite familiar to all of you. These are challenges that people in the industry and in this space have been grappling with and innovating around for quite some time. Many interventions have successfully targeted these challenges, but as you're all too familiar with, many persistent challenges do remain. And when we looked closely at the landscape of how different pilots, programs, and policy interventions have intervened, this is what we found. In the area of compensation, we saw that through wage and benefit mandates, New York City's home care workers have seen meaningful improvements in compensation, yet wages still do not attract enough workers to keep up with consumer demand or compete with other low-wage industries. And with such low reimbursement rates and margins, stakeholders report that mandated compensation increases may have come at the expense of other aspects of job quality investment. In hours and scheduling, staffing and scheduling challenges are really at an all-time high in New York City, yet few coordinated interventions have directly targeted these challenges, and the recent minimum wage increase that went into effect in October could be exacerbating these challenges. In the area of training, there's ample evidence from studies and pilots that high-quality adult learner-centered training does meaningfully improve caregiver job readiness and satisfaction. However, successful training interventions have sometimes had limited impact on longer-term retention and recruitment due to these other areas of challenge that remain. And in the area of supervision, communication, and support, few interventions have had an exclusive focus in this area, and outcomes related to workforce satisfaction and retention have been mixed, showing both success and sometimes inconclusive findings. Finally, though, in the process of looking at this landscape in all these 4 areas, we identified an underlying systemic challenge: a lack of incentives, recognition, or rewards for employers who invest in caregivers. And within this landscape full of successful pilots and policies, few interventions have been structured to truly incentivize high road practices rather than mandating them or piloting them. So how do we build on successes and help scale? How do we build infrastructure to support and leverage this great work while addressing the gaps and persistent challenges? Across the interventions, there are a number of factors that appear to impact long-term success, such as small test size, often lack of sustained funding, scale of focus or focus on singular issues, data availability, especially on workforce outcomes, lack of incentives, as we've just discussed, and limited coordination and information sharing between agencies. And this last point is quite important. Given this landscape, we see ample opportunity to enhance past and existing efforts. While we know that adjustments to Medicaid reimbursement rates is still the only way to holistically raise home care wages and address the recruitment and retention crisis we see, we believe that new cooperative and collaborative business structures between agencies offer significant opportunity to improve workforce challenges in the interim. We identified 3 specific opportunities for formalized collaboration and coordination between high-road employers to add value to what's already being done: high-road recognition, multi-agency staffing and scheduling solutions, and wraparound caregiver support and resource navigation. First, in the area of high-road recognition, in addition to the essential work of labor in raising employment standards, ICA identified a need for even greater recognition and reward for those that commit to high-road employment. Such an effort would add value by defining what it means to be a high-road employer, helping agencies effectively market their high-road commitments, and leveraging employment and workforce data to influence policy and investments. Second, multi-agency staffing and scheduling solutions. While much progress has definitely been made in this area by matching platforms such as Carina, and we envision a coordinated body building on these efforts with a more explicit focus on staffing and scheduling. Such a system could add value by enabling caregivers to build desired schedules from collaborating high-road entities, while also giving employers access to a larger pool of available caregivers. And finally, wraparound supports. Through the work of labor unions, policy mechanisms, and the will of high-road agencies, the floor has already been raised for caregiver benefits. And an external coordinating entity could enhance this work by helping caregivers take greater advantage of resource and benefit offerings, helping agencies understand the return on investment of various non-wage benefits, and building economies of scale for employers interested in making those investments. So with that, we're going to bring in practitioners to explore what's being done on the ground, and we'll use our same framing to kick off this conversation. First, what job quality challenges remain for New York City's caregivers? Second, how have stakeholders successfully made improvements in these areas, and what gaps remain? And finally, where do we see promise? And with that, I'm very excited to open up the floor to our first group of panelists. Thank you so much all for being here. I'm going to give some introductions to our panelists and then ask them to answer a couple questions in turn. So first we have Kim Allen, who is a caregiver and worker owner at Cooperative Home Care Associates and an 1199 SEIU member. Kim is a tireless advocate and a well-known leader representing fellow home care workers with her union, with the New York Caring Majority and across New York City and state. Second, we'll hear from Andrea Thomas. She is the Associate Executive Director of Sunnyside Community Services, where she oversees their home care programs and home health aid workforce training program. She's also on the board of the New York State Healthcare Providers, as well as the co-chair on the board of the 1199 SEIU Education Benefit and Pension Fund. And finally, we'll hear from Emily Dieppe, the Vice President of Workforce Innovations with PHI. She leads PHI's practice team, focusing on recruitment and retention strategies, training program design and delivery, supporting coaching, supervision, and creating meaningful advancement opportunities within direct care. Thank you all so much for being here today. So I'm going, thank you. So I'm going to direct the first question we have to Kim. Kim, as you know, we touched on some of the key job quality challenges in home care. And I'm wondering if you can speak to how these challenges affect caregivers and what makes a good job in home care or a bad job in home care and why. And alongside that, what can home care agencies be doing or have they done to improve jobs for workers like you?
Good morning, everyone. My name is Miss Kim Allen, and I'm employed by Cooperative Home Care Associates as a home health aide and personal care aide for 14 plus years. And I like my job. I like what I do. I'm also affiliated to 1199 SEIU and Caring Majority. Together, these groups are all on the same page in advocating for better wages and conditions for us home care workers. But being a home care worker is very challenging, especially with the way the economy is at this time. We're finding it very difficult, in the line of having a reasonable paycheck at the end of the week. Our hours are cut, there are shortages of clients. So you find sometimes you do 2 clients in a day with 2 different agencies just to get something looking decent to take home, to assist in paying your bills, taking care of yourself, your family. And then to it all, sometimes when you go to work with these clients, people feel that you're nobody and they treat you with disrespect. They don't appreciate what you come out to do, and it's very hard on us. Very, very hard on us. I can tell you this, right? And this too is due to the shortage, as I said, home care workers and the cases, you know. Traveling between the cases too. That's a very difficult part because sometimes you're working in the Bronx. You're now sent to a case in Manhattan. Getting transportation to get there takes up time. When you get there and you do what you have to do, whether it's a 3 or 4 hour case, when you finish at the end of the day, you get back home, you're exhausted, you're tired. It's putting a strain on us, right? But somebody has got to do it, you know? And especially with the wages. Imagine us with the last increase, we're now getting $17 an hour. When taxes comes out of that and other miscellaneous stuff, when you look at it, you said, what's going to happen to me at the end of my work life? You work 25 years, 15 years, and you don't really have anything to show. By that time, your body physically and mentally is all drained, broken up, and you too need assistance from a home care worker. I've did it. I'm about to come off soon, I guess. I'm trying to hold on. But it's really tough. And I can imagine with my fellow co-workers what's going on in their lives too.
Kim,
So
thank you so much. And I'm sorry to interrupt you.
it's okay.
Thank you for grounding
But
us in your experience as a long-time career caregiver and the realities of what it means to hold such an important job from someone who's clearly as passionate about it as you are. And I look forward to hearing more from you at the end in our moderated discussion.
yes,
Thank you. I'm going to pass it next to Andrea. And the question I have for you, Andrea, is We touched on several key factors for improving job quality for caregivers. Can you speak to the perspective of how you support job quality as the leader of a home care agency and employer? And if there's time, given all the challenges and constraints in the industry, what are the best ways for external stakeholders to recognize and support agencies like yours?
So Faye and team, thank you for inviting me to join such a important conversation. And Kim, I just want to acknowledge your work as a home care worker. And as an employer, your perspective really is meaningful. At Sunnyside, I think what we strive to do, it's really a culture shift in terms of how we look at our workers. I think that it starts from as you enter into the door, you know, how I think Kim talked about feeling respected. And we understand that resources, increase wages, ideally is where we want to go. And I think that that's what we've been advocating over the years. But also we want to ensure that it's a job that someone feel respected on. And I think what we try to highlight and emphasize is how our workers are treated. Within our organization, we actually have employment counselor who really supports our home care workers, especially through our training program. Obvious times there are barriers to employment, whether it's childcare issues, housing issue. And what we really try to do is to support our workers throughout as well. We also try to ensure that our home care workers have a seat at the table in terms of their voice. When we recently embarked on a strategic plan, we ensured that the voice of our home care workers were not left unsaid. So they were part of our focus group, and do they have a lot to share? They talk about the fact that they're in an environment oftentimes where they themselves feel isolated and how they want to feel connected to the organization. So having strong connection to internal folks at the agency level is so important. Our home care workers are in the field. They're not connected like we do in an office space. So it takes a little bit more work for us in terms of how we are connecting to our workforce as well. I recently was part of a group in which CUNY Public Health School, they're doing some work around how to support home care workers through death and dying. And again, oftentimes when we think about we tend to be client focused and client centric and not really balance it with our workforce. And what we really wanted to do is to highlight when a client die, how do we support our home care workers in that field? And there's a lot to work to be done there, and we're definitely not there. I'm not saying that we've solved it, but we want to be intentional around that because we do feel like there are gaps in terms of really have the spaces in being intentional and creating the spaces to support our workforce. I think that again, they're valuable and it's incredibly important that they're elevated and highlighted. And of course, resource to do that. As an organization, we were a recipient of the FMAP funding, Federal Medical Assistance Program, but that's again short-lived. You know, those dollars dry up March of 2023. So while we use some of those dollars, 73% to be exact of those dollars, we're really focused on the retaining our workforce, but also to attract more workforce to the industry. But again, the resource is lacking. Again, after March, we're going to go back to what do we do after March in terms of any of these initiatives that we will implement, how can we sustain them as an organization? So I know that that's a lot that I put out there, but.
Thank you, Andrea. Yeah, I think it's essential we hear from employers, especially those that have such a commitment to thinking critically about how to provide good jobs for caregivers, because caregivers, you know, they don't always interact with the industry, they don't always interact with coalitions or with labor like Kim does, but they do interact with their employer. So that's sort of that's where we can make change.
For sure.
Thank you. Emily, We'd love to hear from you next. And I'm wondering if you could please tell us about how PHI has been working with agencies and caregivers in New York City to address these challenges and what strategies you have found to be successful.
Absolutely. Thank you so much, Faye. And just to acknowledge Andrea and Kim, this is a fantastic panel and I feel very honored to be on it because of both of you. So thank you so much for the opportunity. So Faye, there's so many places we could start. I'm going to start by re-referencing your mention of PHI's 5 pillars of direct care job quality. And for PHI, these are the conditions and the variables that we've seen lead to measurably improved job quality for direct care workers. And you talked about the importance of quality competency-based training for home care workers. So I'm going to start there. And we look at training, it's not only, I'm sorry, I have a guest, as a key retention strategy, since we know that workers who are prepared and confident and feel like they have the knowledge and skills that they need to do their job well, they're much more likely to enjoy doing that job and to stay, but also as a way to improve care quality and delivery as a whole. And for PHI, we focus on the importance of training, not just at an entry level, but recognizing that training is this really critical vehicle for career advancement. And so we ask ourselves, what are the core competencies that direct care workers need at an entry level, recognizing that there is rapidly increasing acuity among home care clients, among the folks that they're supporting day in and day out, but also what are the core competencies needed to be specialized or upskilled in a particular condition like dementia, like palliative care, hospice, and what core competencies are needed to ultimately advance into a role where you are operating at the tippy top of your scope, where you are that person who is fully integrated as a care team member. And most recently, and this is the sort of the more hands-on example that I wanted to offer, PHI and Cooperative Home Care Associates, so where Kim works, we launched a new hybrid home health aide certification course. And this very much built off the lessons and best practices from NYACH and CUNY, so shout out, thank you all. And this program, it's been incredibly successful. We're only a few months in, but it is showing us that we can deliver that high quality competency-based adult learner-centered training. We can do that online, and we can do it in a way that doesn't sacrifice those well-established training standards in New York. And we've seen that this increases accessibility to these types of programs by offering greater flexibility. And I want to stress that when we talk about greater flexibility, a part of ensuring the authenticity of that flexibility is our efforts in connecting learners with the supplies, the materials, the tech that they need in order to fully participate. So for example, all of the learners receive a Chromebook, they receive a hotspot, they receive cooling pads, they receive any of that sort of hands-on equipment that they need to be able to join those digital webinars. And ultimately what we've seen, oh, and one other thing too, sort of in addition to that, it's not just giving folks the hardware, but then taking the time to individually sit down with each learner, ensuring that they have an orientation period where they can practice logging in to the class, where they can practice accessing those materials so that we're troubleshooting some of those pain points before folks are actually in the online classroom. And I think ultimately what we're seeing and the ultimate goal of this type of online training program is that we want to strengthen and increase the pipeline of new folks coming into this profession.
Thank you, Emily.
Yeah, no problem.
Thank you.
I'll stop now. Can I have 10 more minutes? I'm kidding.
I want to give you each 30 more minutes. We invited too many great leaders here today. So that's on us, but we are going to keep it moving. And I look forward to bringing you all back up at the end for our discussion. So thank you so much to Kim, Andrea, and Emily. Next, we're going to transition to hearing from 3 speakers who are going to share with us some innovations in high road employment from outside of New York City and sometimes outside of home care too. And the first person we're going to hear from is California State Controller Betty T. Yee.
Good morning, everyone.
Good morning. Thank you for being here. I'm going to give a short introduction to you and then turn over the stage.
Sure.
Controller Betty Yee was elected in 2014 and re-elected for a second term in 2018. She has more than 35 years of experience in public service, specializing in state and local finance and tax policy. As Chief Fiscal Officer of the world's fifth largest economy, Ms. Yee chairs the Franchise Tax Board and serves as a member of the California Public Employees Retirement System and the California State Teachers Retirement System boards. The Controller's work on the Future of Work Commission helped give rise to the High Road Employer Certification Initiative, which she will talk about today with us. So thank you for being here. We really appreciate your time.
Of course, thank you so much, Faye, and really a pleasure to join my fellow panelists. It is always in order, I think, today, given what we are all experiencing with the economy, and certainly as we're trying to get to the other side of this pandemic, the evolving nature of work, and certainly the importance of the care sector. As you mentioned, Faye, in 2019, California Governor Gavin Newsom signed an executive order establishing the Future of Work Commission, on which I was proud to be a member and to serve. And the commission, 21-member commission representing business, labor, government leaders, was tasked with developing a new social compact for work and California workers. And the commission, in my mind, really the work was grounded in the current state of work in California, where we're seeing growing inequality, not a lot of economic mobility for so many of our workers. And there were two kind of data points that really created kind of the bookends for my participation on the commission. One, the fact that for the past 40 plus years, almost 45 years, we've seen productivity just really expand exponentially, and yet wages remain quite stagnant for workers. And then secondly, the current state of work, where in California at that time when the commission first convened, 31% of workers in California earn $15 an hour or less. And when you think about California being the fifth largest economy in the world, how do we sustain just a strong economy with that kind of foundation? And so the commission was tasked with developing a new social compact, and our findings really, our recommendations really fell into about 5 categories. And one, ensuring that there are jobs for everyone who wants one. Second, eliminating working poverty. That's this idea that one job should be enough to provide a livelihood for workers and their families. To create a 21st century worker benefit model and safety net that really recognizes the evolving nature of our economy, the changing nature of work, contingent work, just so many of the new realities about what work looks like today. Raising the standard and share of quality jobs, and this was a really great focus because most of the policy discussions that we hear about is about increasing the numbers of jobs, but the focus on quality really had been missing. And then lastly, looking at how we future-proof the California economy for promoting jobs and skills. So really grounding this in all of the policy work that we have in terms of how we promote economic growth. And so much of the commission's work took place during the height of the pandemic, when the value of California's 8.3 million frontline workers, especially in the care sector, was impossible to ignore. And even as the commission was identifying and defining the care sector as a work-adjacent issue, in other words, this is an issue where to really get to job quality and to really talk about how we have full employment, that we had to address the care sector as a work adjacent issue. It became very clear that the care sector is the issue. And so this is what we have to focus our attention to. And so we know the needs of our caregivers in California in the future. Lots of challenges, lots of disparities. In the years ahead, we're expected to face a labor shortage of about 3.2 million paid direct care workers. And so the work is just really needs to be front and center here. So what the work that culminated from the commission's recommendations, I took to partner with the Drucker Institute on the High Road Employer Certification Initiative. And this became legislation that still is having to see its way to become law, but specifically the legislation required private sector employers with more than 1,000 employees to annually submit data relating to workforce size, pay, hours, scheduling, internal promotions to managerial positions, benefits, ratio of employees to independent contractors and temporary workers, workplace safety, annual turnover, equity, a bunch of these metrics that we think are pretty common in terms of what companies keep track of for regulatory reporting purposes. And with this information public, as the bill would mandate, workers would have greater insight into job quality with the companies in which they are a part of. Information on a company's workforce, demographics, retention, and compensation could also benefit investors and companies as well in terms of how we do better for investors, just what that return on investment would be in these companies. And in recent years, we've seen increased calls by shareholders for companies to disclose these kinds of metrics as part of their sustainability reporting as well. So there's just been this growing push for companies to disclose, and even the Securities and Exchange Commission has been trying to mandate this disclosure. In the prior administration, under the former president, there was a rule that was passed by the SEC, but frankly, it gave a lot of employers an out in terms of how and what they reported. And so there is a growing movement now to try to mandate and standardize that reporting. And the legislature then could take this data, make it public. Everyone is very aware about how these companies are doing. And we would establish then a certification program that would provide incentives like procurement, contracting preferences, tax benefits, workforce development funding that would be prioritized to companies that would be identified as high road employers. And so while this bill is still being discussed, we'll keep working on ensuring that our policymakers and employers are aware of the value of disclosing these metrics. It has been an all-out effort to just try to get education and awareness up on these issues, but we believe that this kind of initiative is what's required for all of the partners surrounding this whole notion of high road employment to really be actively involved in how we make sure that our workers do have an increased agency and voice in the work that they do.
Thank you for sharing that really powerful and inspiring work with us. And we look forward to connecting a bit more about it in the closing discussion. Thank you,
Sure.
Controller Yee.
You're welcome.
So next up, we have Paul Spillman. Paul is the co-founder of Labor Exchange. Building on his long-standing experience in technology and business, Paul developed Labor Exchange to help the individual achieve a better working life with increased opportunities while developing businesses that challenge current ways of thinking and take action around critical issues. So thank you, Paul, for being here today. I'm really looking forward to hearing more about Labor Exchange and Care Exchange. And we all have to give Paul a little bit of grace today because he's losing his voice a little bit and he's still here with us. So thank you, Paul.
The benefit of that is I can't talk too much. So if I share my screen, can anybody, you should be able to see a slide about Labor Exchange.
Yes, thank you. It looks good.
We're currently a UK-based business, but for a lot of what we found out by talking to other countries and collaborating with people, a lot of the problems in care are similar or the same. Well, there you go. That's it. So a bit about who are we? We're a socially driven business. When we first set up, we were set up to help people on low paid, insecure work to improve their working lives. Well, at this point, we weren't involved in care, but it was sort of an extension of what we were going to do. But we're mainly looking at getting people in these sort of low paid, insecure jobs into better working, better working ways, getting better jobs, better pay. And a lot of these people are missed by mainstream recruitment businesses, and it may be because they can't do a CV, their language is poor, it could be a variety of things. All of our team have worked in environments as well where we've seen current recruitment practices struggle to connect with people, and also we've seen how technology really sometimes works against people. So problems we identified, this is UK figures, but again, they sort of play themselves out around the world, In the UK, there are currently over 3.5 million people underemployed. These are people who want to work but can't find work that fits around their commitments, or they may even be caring for somebody. A lot of people are stuck in jobs to a lack of experience and skills. Millions want more work but can't find jobs to fit around commitments, as I said, sometimes around care. And in England, in UK, we have something horrible called a 0-hour contract, which is you can be employed, but the employer doesn't give you any hours to work in a week, which is, well, we won't go into that on this thing. Over to care, there are currently on any one day in the care world in the UK, 160,000 vacancies. That's people they're short, which ultimately means that people are not receiving care. The average pay rate for a care worker is £8.50, which is below the living wage in the UK. The turnover rate for care staff and churn, which means how long they stay, is over 30%. And there are lots of reasons for that around training, making it a better work, making it a better job, making it somebody feel that they're actually respected, I suppose, is the thing in terms of what they do. Labour Exchange was, as I said, was started for to help everybody get into work. We got involved with 2 local authorities or councils in the UK, and we created a work pathway called Care Exchange. We already had work pathways for different things, but we created one for care. And so far that's created 3 types of services. We have a direct payment services, which is to help recruitment. These are for people who go out to people and provide the care to people in their homes. It's to help get new people involved in that sort of role, help with their training, their career progression as well, and help find new people to do this. The other one is care provider services, which is similar to the direct payment ones, apart from it's directed at agencies or in a domiciliary care where there's a care home and they need care providers. And out of that came staff share, which is, it's about scheduling. It's about how you can utilize care workers in a given area. We've tried in this in a council area now, and another one as well, in terms of we are connecting up all the care providers, and they share their availabilities, and other people like a care provider or a thing can link into that to find extra, find more resource. So who benefits out of that? Well, firstly, the people at home who actually need the care, which may be struggling to get someone to see them. The employers, because they're struggling to find new people as well. The local authorities, because in the UK, care is currently really run through the local authorities or the councils. And ultimately, it helps the community because the people are getting their care provided. We also helping get a care worker make their job better. So what impact have we had? Well, there's a few up here, but improved scheduling is the main one in terms of filling the gaps where one agency perhaps is short of workers and they can tap into somebody's workers that are not working. So it helps scheduling, it helps filling the hours that are being missed. Increased resource, we're building a bigger pool of people that are available. Because our system has training built in within it, we are creating upskilling and a better trained workforce, increased care capacity. Because of the way we recruit and the people we're connecting with, there's a lower cost of recruitment. That feeds into you can help pay people more as well. There's quite a few, I don't think I've got them all on here, but they're the main ones we've got there. So what do we know about our experiences of trying to change? The first thing, top one is change is not easy. When we first started, it was very hard to get people to accept, to look at doing different ways. Putting the candidate first, the care worker first, is challenging for an employer. They want to, but they are pulled in other directions around money and everything else. So it's challenging. Creating buy-in is important across, everybody that's involved is a key. And the other thing, technology does scare some people, but we try to make it as simple as possible. But the one thing we learn, all of us, out of it, if we kept doing the same thing, nothing will improve. And this is our evolution. Labour Exchange, as I said, is how we started. It was trying to help everybody get into job. Care Exchange became the care part that we do. We added the domiciliary care and the home care part. Staff share has come out of that. There is another bit to come, which if we get talking in the future, there's another bit to come as well that we're currently looking at as well. That's really Labour Exchange in a short period.
Thank you, Paul. Thank you so much. We appreciate your fortitude with your voice too. Next up, I'm going to bring up Lydia Romero. Lydia is the founder and CEO of Work-Life Partnership, which helps businesses recruit, retain, and value their employees by providing access to the resources and support they need and offering insight to employers. Lydia also leads a startup called Employee Benefits Marketplace and is also a 2-time Aspen Fellow. So welcome, Lydia, and thank you so much for being here. We're really looking forward to hearing about Work-Life Partnership and your work.
Yes, so I'm Lydia Romero, 13 years working with frontline workers. I started a program called Work-Life Partnership. We are a 501c3, and we serve workers in 30 states across the United States. Our model is pretty simple. We provide wraparound resources to employees who are struggling with issues that are preventing them to getting to work. Things like childcare, transportation, mental health, domestic abuse, housing, food insecurity. Those are the things that are really preventing them and preventing employees from getting to work, staying at work, being productive at work. Our employers pay for the services that we provide. We are a social enterprise. They pay it like they would pay any other employee benefit, per employee per month model. So we provide a resource called a navigator. This is a person. Our niche is people helping people with real problems. This navigator is assigned to a business. They work one-on-one with that employee who is struggling with whatever issue is preventing them from getting to work. They work one-on-one. They know these issues are multifaceted. We know most of the time there's just more month than money, but a lot of these issues stem in financial insecurity. And we want to make sure that we are saving them time, right? So we're not having them chase resources across the community. Our navigators should know the exact resource and organization to send that employee to. We leverage government, community, and internal resources. I'll give you an example of our internal resources. One of our biggest employers is Starbucks, and they have about 142 internal benefits. That makes it almost virtually impossible for someone to navigate, especially when you're sort of in the tyranny of that moment. So our navigator's job is to understand what are those benefits that the employer already provides, so they can get that employee the help they need exactly when they need it. If you go back one slide, thanks for bringing these up. So here is, the one with a lot of text. Thank you, Stephanie, nice job. So there's a slide here that shows the quotes just from employees who come to our askthenavigator.com, where they're giving us what the issues are. And you can see from those quotes that they are multifaceted. It's not just, hey, I'm losing a roommate, right? It's I'm losing a roommate, I can't make housing. And by the way, I can't buy groceries. And so our navigators are helping people with those resources. I will then also say that what we do is that when we work with people one-on-one, we're able to gather the stories and the data and create what we call employer scorecards every quarter. This is the practice that we build with employers. It's not immediate. It usually takes a year of them having been with us to understand sort of the trends and what we're seeing are the deepest issues with their workforce. Where we help employers is that we help them, there we go. If you click on that link, it should pop up. Thank you. This employer scorecard is gathered from the from our one-on-one work with their people, we hope employers start to see trends. I use this information to help design better jobs. Many times I ask employers, if you knew this information, if you knew that half of your workforce was struggling with housing, if you knew half your workforce, had food insecurity, how would you invest differently? And usually that's I wouldn't have spent X amount on a pedometer program. I wouldn't have thought, X amount on a consultant to come build some sort of wellness and training program if I knew that people were really, that they were living in this scarcity. So we use that data and we use the stories to inform employers that they can make better decisions, I think, in their talent investments moving forward, specifically for frontline workers. I will close in saying that the sort of the crosswalk I see, and it's very simple in job quality, and I think is your last pillar of intervention. It's the supervision, communication, and support. One of the things we get all the time from our feedback and working with employees is that they just felt like they have a friend at work and they felt like they had someone to listen to them. And listening is free. So even if you can't, as an employer, afford everything, I know that there is always competition in a budget. I'm an employer myself with 42 people. I've grown a company. I'm an entrepreneur, a business person. Even if you feel like you can't afford one single thing more, I think the listening, the communication, that could be free. We just need really good leadership. So thank you.
That's a really powerful message to end on. So I really appreciate all of the presentations we've gotten from our panelists. And now I'm excited to bring back up all of our panelists from the first round, the New York City stakeholders, as well as the second round. And we're going to go into a moderated panel discussion. So I think the first question that we have, I'm going to give it to just 3 of the panelists. We're going to hear from Controller Yi, Kim, and Liddy on this one. The first question is about communication, which is, I guess, is fitting given how Liddy closed us out. So the term high road is new for a lot of people. And I'm wondering if you can share with us what lessons you've learned from your experiences communicating about issues of job quality or about high road employment practices, if that's a term that you use, to some of your key audiences. So I'm going to open that up to Controller Yi first. Thank you, Controller.
No, thank you, Faye, for the question. I think for workers, even if they have not heard of this term and concept, high road employment, intuitively, I think they understand what it means. They know when they feel valued. They know if their efforts are likely to lead to advancement. They know when they are potentially in a dead-end job. And I would ask workers to envision, a work environment where they feel valued and grow and can advance, where their certainly their labor and time is as valuable as their employer to their employer as it is to them. And I think when thinking this way, workers, the concept is quite easy. But we've not had those conversations very often with workers. When we think about high road employment in California, we think about it as a partnership between employers and workers. And so the same conversation that state government has with workers, we have the same conversation with employers so that everyone is on the same page. It is this idea that industry demands, particularly in the care sector, are best solved when we have this kind of partnership and there is equal voice in terms of informing the solutions. I think that when communicating the importance of high road approaches to employers, it does require a different approach. I found that many employers actually see the value of high road employment. They know that investing in human capital, correlates obviously to a higher return on investment, increased workforce productivity, reduced turnover, all the things that we know in terms of how work is valued in companies. But I will say that many of them are not interested in being first out the gate to showcase that. And so for whatever reason, maybe it's an issue about competition, that these are not things that employers necessarily are taking pride in. And I wish they could take more pride in it, because so many companies actually are starting to do the right thing, and we want to showcase that. But one aspect I do want to be sure that I introduce is that I do sit on the nation's 2 largest public pension funds. And to the extent that we see private equity firms really taking over a lot of our sector companies, particularly in retail and healthcare, we are very sanguine at particularly at CalPERS, about what this needs to mean for workers. And so last year in 2021, there was an initiative that was established called Ownership Works, where part of what we want to be sure that we are counseling private equity firms is that we have an expectation about the fact that if there is going to be private ownership of these entities, that workers have to be a part of how we have these companies create wealth. And so just stay tuned for those kinds of initiatives. I think investors are going to have a louder, more outsized voice with respect to looking at the issue of higher employment. Then lastly, really quickly, for policymakers, I would say still a challenge in terms of how we move the conversation from numbers of jobs to job quality. And this is something that, as we talk about this data that we're all just so committed to in terms of informing the work that each of us is doing, we hope that the data can help tell that story in terms of why we have to focus on job quality to really be sure that we are moving the needle on uplifting our workers.
Thank you. Well, we're lucky to have leaders like you who are pushing that policy conversation. So I'm going to hand that question over next to Kim. Kim, what would you say? What have you learned about communicating about job quality, good jobs, especially in home care, to the various people you talk to through your leadership in your agency and in your union?
Well, for me, reaching out to the workers, letting them understand that, okay, we know it's tough, but we are willing to help in whatever way we can. Identify people with the different skills, advance them through training. I think the biggest thing for us would be like English as a second language, encouraging workers to come out and learn English. So you can fit into any case. Maybe there's a case available, the person only speak English, you only speak Spanish, but if once you learn the language, you can go and do that case. It's a replacement for a couple hours, yes, and then there's modern technology in the way that helps you in the home with your client, like there's new Hoyer lifts, there's new way how you handle your client who has certain chronic illnesses, send staff out so that they learn, hands on, and use them when they come back with the skills they've acquired. I think it would be very good for the agency, so you're able to place them. The cases that you have that needs these things. Okay, these people are trained in that. Yeah, you send them out there. Yeah, there's a lot they're doing. I know the cooperative is trying very hard, teaming up with 1199. We've done a lot of classes. I did Alzheimer's training, but I've never really had a client in that condition. I've had with other conditions, but I take as much as I can, make myself available. It's good to have these little skills. You don't know when you'll be called upon to use them, right? So that's very good with 1199 and cooperative. I commend them for that, and I will always support it, And yeah, meeting with the staff, talking, find out what are the issues, what are they going through, like the controller said. How can we help in a way that you can give 100% or more of yourself in this area? Some people are shy, they just take stuff, and then eventually they say, when they can't take it anymore, they just bow out easily. But yeah, we could help save them, save the job, yeah, find out what was going on, help, and so, how I so love my job. Yesterday, I had a procedure done to my right eye. I should have gone home and relaxed because it was painful. I tried with the left, but then I was putting pressure on the left just to go and work with my client for my 5 hours, And I got through by God's grace. I'm feeling much better today. This treatment will be for the next 3 months, one every month. But I love my job. I don't know, somehow I cannot stay home unless it's necessary. I go out there. These people need me, they depend on me, and yeah.
Yeah, Kim, wow.
Thank
Well,
you.
we're lucky to have you here, and Cooperative Home Care Associates and 1199 SEIU are also lucky to have you.
Thank you.
And your coworkers are lucky to have you as an advocate, so thank you for sharing that.
Yes.
And to wrap up this question, we're going to hear next from Liddy. So Liddy, yeah, your perspective on communicating about job quality.
I love this. This is just like a Thursday pep rally too. Thank you, Kim. You're giving me the feels. I first of all, I always have to remind myself that I am an employer too. And so anything that I'm asking someone to invest in, right, I have to consider, even though we're a nonprofit, investing in that myself with my employees. That really frames how I go and approach employers to purchase our service, basically, and to purchase our service, and coming from a place where they don't know anything, right? We are very unique service still after 13 years of operating this sort of model. And not until COVID did it really make sense that these life issues are showing up at, in employers' workplaces and affecting their bottom line. So when I communicate this to employers, I'm talking about retention, right? Reducing turnover costs, increased job confidence and how much that improves the worker's productivity, decreased stress level and how that reduces, right? If you think about the health effects and hopefully later on in someone's health benefits package or the cost of healthcare. And I think the last thing I sort of focus on when I go to employers is there's going to be low road employers and there's going to be high road, or you can't have high road. We hope to do business with those who are paving the way, the frontiersmen, right, to this. Sadly, sometimes it ebbs and flows depending on political power too. And as a person who is asking a business to pay into this, I have to always remind myself about that. But I will say that the best way to understand if this is a good match with an employer and we're not just a Band-Aid, but part of their strategy is to do this, is to say, how would you confirm this thought, which is the jobs of the past were about the muscle, the jobs of the present were about the brains, and the jobs of the future will always be about hearts. And those leaders and those businesses that are going to survive and thrive in this, what I feel like is a new economy of care and giving and empathy, are going to be employers who lead with their hearts. And I think everyone here is one of them as well. I would also say, Controller, I was just in Fresno, California a couple of weeks ago, presenting to a group of manufacturers by the Fresno Business Alliance, I believe, and was just stunned and inspired by the agriculture and manufacturers that were there, all wanting to listen about our model. So there's great pockets of hope. Thank you.
Thank you, Liddy. Okay, we have a next topic we'd like to hear from some of you about. And we're going to hear from Emily, Paul, and Andrea on this one. So a few of you in your remarks and your presentations highlighted the importance of data to improving caregiver job quality or job quality in general for those who work outside of home care. Can you share more about how collecting better data about employer practices can help us build better jobs for caregivers? And we're going to turn it over to you, Emily, first.
Sure, thanks, Faye. I love this question. And when I think about data, particularly within PHI's work, my mind goes in two directions. So one, it's recognizing the importance of data in the actual design and development of our intervention so that we're maximizing impact. And an example of this is, and we've done this in partnership with a number of people on this call, but looking at, for example, common or frequent conditions that often lead to emergency room utilization. And so building a suite of training topics and programs around those specialty conditions so that we're really targeting the ways in which and the variables that ultimately drive ER use. And so just being like, that's one example of like really digging in and looking at the data and seeing where is that opportunity dispersed, and it's not necessarily equally dispersed. And second, the common theme I feel like of today's call is just the importance of sustainability and continued investment. And we're not able to credibly make the case for that sustained investment unless we're building the evidence base around these types of practices and strategies. And so whenever we're thinking about creating a new intervention, a new advanced role, a new training strategy, we're thinking about what is the data that we need to collect, what is the outcome data that will ultimately help us calculate the return on investment so that we can make those cases to policymakers and legislators and payers and others. I'm going to drop a link in the chat. This is to PHI's newly released guide. It's an implementation guide for an advanced role that we developed called the Care Integration Senior Aid. The reason I'm spotlighting this is because there is a methodology embedded in this document that anybody can use. It's customizable, and it walks participants through how to calculate ROI for a particular intervention. So just one sort of concrete tool and way that we can think about data collection in this space.
Thank you, Emily, and thanks for sharing that resource. Paul, what would you say? How has data shown up in your work?
Data for us, especially with staff share, we can analyze the peaks and the troughs of when care is needed. And that also then feeds into recruitment side in terms of if there are not enough care workers for a particular time, we need to obviously look for people who can work in those times. And that may be that we need to find new people, which also feeds into something we've been doing a while, which is looking at care workers are a special type of person. It's not a job for everybody. So we've been looking at the characteristics of a good care worker and trying to match that into people who've not done the role before. So within our platform, we look at data points of people who've not done care, but show characteristics of they could potentially be a good care worker. And then we start to move them in our system around down to the care as a care pathway that gets them into care work. So the data for us is around resources and where it's needed, where are the pinch points, I suppose, of where care is slacking because there is not enough resource to cover it. The other part is around recruitment. How can we find new people to enter this work environment, people who may not have even thought about it, and that's about characters, and their personalities.
Great, thank you. And Andrea, last, as a home care employer yourself, what kind of data are you tracking, or what kind of data do you wish other people were tracking?
So data, the conversation around data is so important, and Emily and Paul sort of summed it. But as I was listening to the conversation, I think through the lens of the employer around how data drive the conversation in terms of impact, in terms of even with our workers and our internal staff. So for example, we talk about hospitalization data, but internally, we collect the data, but are we sharing that information with our workforce, for example, in terms of how they're impacting the work? I think when we talk about how folks get excited around the work and how they feel fulfilled, is how we are sharing that data, both internally and externally. On a policy perspective, oftentimes when we're up in Albany, our legislators sort of challenge us around the data to support the argument that we have. And collectively, as employers in home care, oftentimes that is fragmented. We recently actually just created a position organizationally around outcomes and evaluation, because we really want to look at our impact in terms of our work around data. So for us, it's really important work. But I think collectively as an industry, I feel like that's where we struggle, because I think within our own sphere and organization, we're all collecting the data, but how can we uniformly share that data in terms of impact, in terms of the industry? And I think that that's where there's still some more work to be done there.
Thank you. Thank you so much. So we have one more question for you. We're running a little bit short on time, which I think could have been predicted. So we're going to keep answers to the last question to just 1 minute. So powerful, punchy statements. And the question is, what can be accomplished when businesses work together? And we're going to actually keep going with you, Andrea.
So one, I think ensuring that we create more of these spaces where collectively sharing of ideas, having a seat at the table is important. I think it's incredibly important. I think that these are good, rich conversation, but then what? So I challenge us all that, like, I want for us to continue, but think about how can we enact some of this rich conversation as well.
Thank you. Paul, what can be accomplished when businesses work together?
I think Andrea's touched on quite a bit of it. I think what we found is within the care network, no one business is going to be able to solve all the issues, and it is about working together. I think also if you get different businesses working together, it stops certain other businesses being closed, you know, only focused on their part. It broadens their overview, and it gives you know, access to new ideas. Somebody over here might say something and it sparks something somewhere else.
Great. And Liddy, close us out.
Yeah, I will. Accountability, they could be accountable to each other. I think we need to get off the wage issue, just thinking about wages. The average people who use our services, their wage is $23 an hour. It's not minimum wage anymore. So there is this gap, right? So I think employers can hold each other accountable, bring up the wage issue, and be ready to tackle it.
Excellent. Thank you. So a big thank you and round of applause to all of our panelists. Thank you so much for being with us today and sharing your experiences and insights. And we look forward to more work together. So thank you. And to close us out, we're going to bring back Danielle Liss from NYACH up on stage, and then we're going to wrap up.
Yeah, so my job is just to say thank you again, both to our panelists and for everyone that joined. As you heard, this sort of work is deeply meaningful work for the people that do it and for the people that try and manage the businesses for it or support the way that work gets done. And I'm super excited for the kinds of things that we can do together going forward. A couple of housekeeping things, which is both this webinar and the last webinar were being recorded. And we will share both that and anything that we decide to do going forward in any other convenings or otherwise with all of you in the next few weeks. So thank you so much for joining.
Yeah, just to echo that, thank you from us at the ICA group. We so appreciate all of our panelists, NYACH, and everyone who's here attending this webinar for being here. And there'll be more discussion to come. Have a great day, everyone.